The World Health Organization has moved to ease fears that the coronavirus can be spread via food or food packaging. Concerns have been growing that contaminated food shipments might cause new outbreaks.
There is no evidence that food or the food chain is participating in transmission of this virus, and people should feel comfortable and feel safe.
New discoveries have sparked fears that the coronavirus could latch onto food and packaging. New Zealand is investigating a cold storage facility as a possible source of its new outbreak. China has also reported traces of the virus on several cases of frozen food packaging. They include a batch of chicken wings imported from Brazil. But health authorities say people who might have come into contact with the product have so far tested negative. Now, for more on this, let's speak with John Nicholls, Clinical Professor of Pathology at the University of Hong Kong. Thanks for joining us this evening. Firstly, how could COVID-19 have gotten onto frozen food packaging or the food itself?
Well, I think it's important to realize that what they're talking about when they say they found traces is that most of the samples which they've done, they've found just the RNA, which means they've just found the genetic material. And most of the studies have not actually cultured the virus. So you actually haven't really found the actually infectious virus, just the RNA. And so when they say very small traces, it doesn't necessarily mean that this food actually is infectious. And that's why, the WHO and the US FDA have gone and said that basically people should not fear food and that there's no evidence that people can contract COVID-19. Having said that, the studies which we did do a number of months ago did show that the virus can be very stable and can still become infectious when it's at very, very low temperatures. So there is a potential that in frozen food the virus may remain stable. But so far, as I mentioned, most of the studies have just looked at finding the RNA, not necessarily the live infectious virus.
So then when you say it remains stable, it can still be contagious, correct?
But potentially, in our studies, we found that after 2 weeks at 4 degrees Celsius, the virus was still potentially infectious. But as has been pointed out, there's lots of steps between the package and the person. They need to actually touch it. There needs to be enough viable, stable virus present, not just the RNA, and it needs to actually work its way through into the respiratory tract. Studies which we did a while ago, we actually looked at hamsters, and we actually fed them some of this COVID-2 to see whether or not you could actually get infection through the gastrointestinal route. And we did about sort of 15 hamsters. We found actually they weren't able to actually get virus through actually eating. So I think through food, the risk is very, very minimal.
And do we know more generally how long COVID-19 can potentially survive and stay infectious on surfaces?
Yeah, well, I see that studies which both we did and also which was done by the NIH is show that basically the virus can remain stable for up to about 10 days at 4 degrees Celsius and on a number of surfaces. But once you reach higher temperatures like 37 degrees, it's only stable for about 2 to 3 days. And at 60 to 80 degrees Celsius, it's inactivated within 30 minutes, which is why most of the high temperature inactivation mechanisms are very effective. So yes, in cold temperatures, the virus is more stable, which is why there was the people thinking a while ago is that this is why the virus could be more potentially infectious in colder weather than warmer weather.
Professor Nicholls, so in a way, it just boils down to hygiene. So what are some of the best practices food handlers and consumers should engage in? After all, we see lots of them donning these protective gears. They have gloves on. What more can they do?
Well, I think you've highlighted a very important aspect, is that where we're actually getting these concentrated events around the world has been in the packaging industry. And there, it's a constellation of factors. You're getting lots of workers in a close area. You're getting fomites, and you're getting particles which can be going from people to people. So it's actually, and it's also because it's a food chain in a food processing, it's kept at low temperature. So I think the outbreaks in both Germany and in America and in other countries is actually the food processing, especially with we're getting animals and seafood. That's where you have the potential for the virus to actually be spreading amongst the people. However, from the virus to actually go onto the food packaging and to the actual consumer, it's actually been very, very low. But I think what's been pointed out before is that so long as people are taking the standard precautions that they normally do about, washing their hands before opening food, I think there's a very, very minimal risk of actually people contracting virus from packaged food. There's far greater risks around in the environment by not doing the social distancing, not wearing the masks, and having infected contact surfaces. So I think the frozen food is the least of our worries.
Well, good to know, and thank you for shedding light on that. We've been speaking with John Nicholls, clinical professor in pathology at the University of Hong Kong.